I'm Dr. William Starsiak. I've had people request me to demonstrate some osteopathic techniques, and I thought that it would be important to first discuss this important concept of the difference between memorizing techniques and understanding a principle. So I can give someone step by step, say you have a tender point in a certain muscle. I could go step by step and tell them how to treat the tender point in that muscle. I could give them a specific technique. I could also explain the principles that underlie that technique. How someone would go about applying those principles to any given muscle. So that if someone grasped that explanation, the principles underlying the technique, then they could apply those principles everywhere. And so that single technique would turn into countless of other techniques that would invent themselves. As opposed to having to memorize hundreds of techniques for all the different possible dysfunctions in the body. If we understand some of the simple principles that the body operates under and that underlie how it normalizes itself, how it moves back to a more balanced neutral, then someone can allow a technique to invent itself in anywhere in the body. The founder of osteopathy was adamant on this point that we shouldn't simply be parrots. We shouldn't simply learn the techniques that someone else discovered, but that we should grasp the principles and let the techniques invent themselves. For that reason, in all of his writings, you see very little emphasis placed on any specific techniques. He rather emphasizes exhaustive understanding of anatomy and also of the principles that govern the body. The two main principles, or main concepts rather, would be this idea of direct and indirect approach. I have a video on that goes into detail about that concept of a direct treatment and an indirect treatment. And those concepts require the understanding of the idea of a barrier, where an injury leads to a barrier to range of motion. And then the terms direct or indirect are relative to that barrier. So direct technique is where the person treating, the doctor or the physical therapist, whoever they may be, their force, if they're doing a direct technique, their force takes the structure through the barrier. If they're doing an indirect technique, their force finds the position of balance, typically away from the barrier, and then the inherent forces within the patient are what, after the release in the tissues occur, the inherent force then brings the structure through the barrier, not the physician, not the person doing the treatment. So before I make any videos demonstrating specific techniques, I just want to make that very clear, that we handicap ourselves if we try to memorize a bunch of individual techniques. It serves us much better to understand the principles underlying the techniques, because then we're not limited. Whatever we come across, we can apply those principles and get a good result. Thank you very much. Please like this video, subscribe to my channel, and check out my other videos.